Okay, so we're going to be testing for the upper and lower screen, just for some rotation and then different trunk movements. Okay, so first thing I'm going to do with my patient is I'm going to move them passively, and then actively I'm going to get them to do it by themselves. So first thing we'll do, we'll start with the upper trunk. So I'm going to pull you into a forward motion, and then I'm going to pull you back, just like that. Okay? Can you do that by yourself? Good. Very nice. All right, so now we're going to go side to side. So we're just going to lean to one side. Good. Then we're going to lean to the other. Okay? Try that by yourself. Good. So that could be used for reaching side to side, picking up something. Next, we are going to do rotation. So I'm going to put my hands underneath your armpits. Okay, and we're just going to rotate and rotate. And this can be used if they need to look over their shoulder, maybe like changing lanes when they're driving. So the last one we're going to do is a diagonal. So I'm going to turn you sideways, and then we're going to go down and back up. Okay? Good. All right, so we're going to switch sides. We'll turn this way. We're going to go down and back up. Okay? Very good. All right, so now we're going to move into the lower trunk. So first thing I'm going to look at, I'm going to put my hands right above her iliac crest. And then we're going to do an anterior pelvic tilt. So I'm going to tilt your pelvis back. And then I'm going to tilt it the other way. And that posterior pelvic tilt. Okay, so can you try that by yourself? Good, and then move that back. Very nice. Good. All right, so now we're going to look at rotation. So keeping your upper trunk kind of stable, we're going to rotate sideways. Good. And then rotate the other way. Okay, and try that by yourself. Good. All right, so now we're going to do what's called a hip hike. So we're going to lean over to one side, and you're just going to try to lift this side of your bottom off the table. Good. And like that. Okay, can you try it by yourself? Good. Good. And that can be used for scooting back in a chair if they need to. And then the last one, we're going to do diagonals again. So we're going to kind of turn to the side. We're going to go forward and backward. Okay, try that by yourself. Okay, now we're going to go the other way. Forward and backward. Okay, last time. Good. Okay, so now we're going to try to put some of those movements together. So one reason you would need upper trunk and lower trunk rotation is if you're going to reach behind you and put on your seatbelt. So if you were to go here and reach behind you and then pull it back, like you're going to click it in. Good. Okay, so another one that you would use is if you're going to tie your shoes. So if you're going to reach down and try to put on a sock, you're going to have that hip hike. Good. And you're also going to have a little bit of that trunk flexion as well. Okay, so we're going to work on some functional movements that you would use at home as well. So if you don't mind, can you go ahead and lie on your side? Good. Bring your feet up and then kind of lie on your back like you're going to be lying in bed. So with this one, we're going to be looking at rolling. So you're going to get a little bit of that trunk rotation, lower trunk rotation, and upper trunk rotation as they sit up. And then some of that upper trunk flexion and then extension as they're sitting up. Okay? And then, so we're going to look at a sit to stand for the pelvic anterior and posterior tilt. So for your feet to hit the floor, let's go ahead and sit on this ottoman for me. Okay? And as you stand up, remember that that anterior tilt backwards as you stand up. Good. And then we're going to address the posterior tilt as they sit back down into their chair.